The Chalmers P. Wiley VA Ambulatory Care Center is part of the VA Central Ohio healthcare system. This healthcare system serves veterans in the greater Columbus area. The VACOS has been improving the health of men and women who have proudly served our nation. We consider it our privilege to serve the healthcare needs of our veterans. This facility has no inpatient beds, and thus our program is focused on outpatient or ambulatory care. Hi, I'm Mallory Percy. I'm our Residency Program Director for our PGY1 Pharmacy Residency Program. Today, I'll be giving you a tour of our facility and giving you some insight into our wonderful residency program. In addition to our main facility, we offer services in our 4 community-based outpatient clinics in Marion, Zanesville, Newark, and Grove City, Ohio. We have ample on-site parking and are easily accessible to public transportation. The outpatient pharmacy is located on the first floor. Here, veterans speak with a pharmacist to receive counseling on their medications. Our clinical pharmacists provide excellent care, making sure veterans understand how to use their medications, ensure safe prescribing, and answer medication-related questions. The counseling and dispensing rotation focuses on prescription processing and patient counseling.
Hello, welcome to the VA Central Ohio Healthcare System Pharmacy Service and to our Postgraduate Year 1 Residency Program. My name is Karen Core and I'm the Chief of Pharmacy, and I'm also the Administrative Rotation Preceptor. Let me tell you first a little bit about our VA Pharmacy Program. We have about 60 employees, 40 of whom are pharmacists in a variety of roles. We have specialists in primary care, we have specialists in oncology and infectious disease, behavioral health. We have a number of support staff, technicians and secretary, administrative officer that help us run a very robust pharmacy program. Of those 40 pharmacists here, about 20 of them serve as preceptors for our residency program. The VA Central Ohio Healthcare System serves about 43,000 unique veterans in the Central Ohio area. As an ambulatory care facility, we have no inpatient rotations, but we do have a number of opportunities for residents to experience ambulatory care services in a variety of settings. One of those areas is oncology, another is behavioral health, infectious diseases, primary care, home-based primary care, and a variety of other administrative and drug policy rotations. Let me tell you first a little bit about the drug policy rotation with our Associate Chief for Clinical Operations. That particular rotation will allow you the opportunity to learn more about drug policy development and utilization throughout our facility. Things like medication use evaluations, how the Pharmacy and Therapeutics Committee works, and how that information then gets moved and translated to the Medical Executive Board for further evaluation and assessment. They will also give you an opportunity to work on our pharmacy newsletter, The Antidote. We also have other drug policy opportunities looking at the staffing rotation and the entry of adverse drug events into the global VA systems. For the administrative rotation, we'll be spending some time on leadership and management within the institution. I'll try to give you an overview of VA pharmacy practice and the various aspects involved in the pharmacy service as an enterprise. We'll look at procurement, budget, leadership and management, human resources, and we'll talk a little bit more in detail about how each of those aspects are managed within the VA and in pharmacy administration as a whole. We'll have an opportunity to have you do some interesting shadowing opportunities, perhaps with our supervisors, and also give you an opportunity to look at medication use evaluations and how those will translate into VA policy here at the Columbus VA. So we look forward to seeing you here, and thank you very much.
Come check out one of our clinical pharmacy specialist offices. In here, our residents have their own desk space.
Hi, My name is Katie Hsu, and I'm one of the pharmacy residents here at the VA Central Ohio Healthcare System. So I chose this residency program because I loved my experience here as a student, where I had really amazing, supportive preceptors who were really interested in my goals and kind of my interests and how I wanted to learn. And as a resident as well, I've had a really great experience with the preceptors, and I've experienced the same support as well. So that's been really amazing. And also, this residency program here is very unique in that it's an ambulatory care site. So there's a lot of opportunity to really practice and hone your ambulatory care skills and your clinical skills, and also patient care skills. In a lot of the clinics that we have, for example, the PACT or primary care clinic, as well as oncology clinic, and also anticoagulation, and also more than that as well. So in these clinics, pharmacists can act with autonomy and can act as providers for patients. So definitely, if ambulatory care is an interest of yours, this is a really great program for you.
Hi, my name is Hannah, and I'm one of the residents here at the Columbus VA. And one of the reasons that I chose this residency was because I am very interested in ambulatory care, and this residency is perfect for it. It gives me longitudinal experiences in both the primary care clinic and the anti-coag clinic, as well as touch points throughout the year in a multitude of experiences. All of the preceptors here want to help you learn, and nobody is off-putting. It's a great environment for learning and becoming the best pharmacist that you can be. And if you are definitely interested in ambulatory care, I think that this would be a perfect fit for you.
Hi, my name is Liz Hansen. I'm the Clinical Oncology Pharmacy Specialist. This is our Oncology Infusion Center where we come to see cancer patients. Pharmacy residents will have the opportunity to do a 4-week rotation with me. During this time, we'll be performing patient education, seeing patients in our oral oncology clinic, as well as doing drug monitoring. We look forward to meeting you.
The VA uses primary care teams called PACT, or Patient Aligned Care Teams. PACT transforms veterans' care by providing patient-driven, proactive, personalized, team-based care focused on wellness and disease prevention. This approach results in improvements in veteran satisfaction and healthcare outcomes. PACT puts the patient at the center of a team whose focus is on their care and health goals. This team includes a provider, RN, LPN, medical support assistant, social worker, dietitian, mental health, and a pharmacist.
So this is an example of one of our primary care hallways. Each primary care hallway houses 3 providers and the 3 nurses that work with them to help room patients when they're seen. This is our yellow team hallway. Each team has a clinical pharmacist who's assigned to that team, and you can see that we also have our clinical pharmacist office, which is centrally located next to the team so that they're readily available for provider questions or any patient care needs that come up. Our pharmacy clinic hallway is located just down the way from one of our clinical pharmacist offices. Here, pharmacists have clinic rooms where they see anticoagulation patients, as well as our comprehensive medication management clinics with PACT, and also some infectious disease patients. This is an example of one of our pharmacy clinic rooms where people can be seen either in person, so face-to-face visits, over the phone, or virtually with a video appointment. Our residents do clinic appointments all different ways so that when they finish their residency and begin their clinical careers, they're well versed and able to care for patients in multiple modalities.
So my name is Amanda Zeke. I'm a clinical pharmacy specialist here at the Grove City VA Clinic. I provide medication management to our primary care clinics as well as anticoagulation services, and I do that via point of care testing. What initially drew me to the Columbus VA residency program was really just the ambulatory care focus. That's something that's quite unique for a PGY1 residency. And it was really the longitudinal experience that I got that gave me the skill set and really the confidence to be able to immediately obtain a job at the VA and work as a clinical pharmacy specialist. So after residency, I did move down to Georgia, and I worked at actually a brand new outpatient clinic for the Georgia VA system, and I was the clinical pharmacist down there. I was actually able to build my own practice as well as expand our services into things like COPD management, and I really believe that my experiences at the Columbus VA residency program really allowed me to obtain that position as well as really expand those services down there. And then one unique thing about this residency program is they do allow you to pursue a teaching certificate, and that was really important to me. So I did obtain a teaching certificate through the OSU College of Pharmacy. And with that experience, I've been able to mentor pharmacy students. I continue to mentor pharmacy students at OSU College of Pharmacy, as well as I'm a preceptor for students and for residents here at the Columbus VA Clinic.
One of the things that I think makes this program special is our preceptors. We have preceptors who did their residency here, as well as many that came from other VAs. All provide invaluable perspective, which helps our program excel and continue to grow. These preceptors really prioritize the care of our veterans and are a shining example of how we can give back to those who served our country. If this is a career goal of yours, you would truly learn from the best of the best here. Thanks for joining me today. I hope you learned more about our residency program. For additional resources, please visit our residency website page and don't hesitate to contact with any questions. We hope you consider applying to be a part of our wonderful pharmacy team.